Thanks to my friends, my name is Leong Kaljun and I will present about the treatment plan. There are four parts in treatment plan, which is problem list, evidence-based intervention, cost of treatment, and number and frequency of treatment session. First, the problem for our client, Fitri, was low mood when he was diagnosed with HIV. His thinking full of negative hopeless because he always think about he never get healthy anymore. The second problem were stress and suicidal thought. Fitri scared that he will discriminate by others and scared about the future. The third problem faced by him is side effect of medication. The medicine bring out the side effects such as nausea during eating and cause him to have a fever on and off. The last problem of Fitri is conflict with his parents, and it was because of he avoid a close relationship with his mother, although the relationship before was the closest. For the evidence-based intervention, I suggested Fitri taking highly active antiretroviral therapy HART rather than medicine T-Bactrim. HART was the most famous and suggested treatment in treating HIV patients. Fitri also was suggested to use the combination of HART and person-centered therapy, or in other name, client-centered therapy (CCT). For the course of treatment, I suggest Fitri take the CCT in individual because of his sexual orientation was private to him, and Fitri agreed. We had a conversation and finally set out a goal on first, accept the current condition and live more bravely. Second, rebuild the relationship with his mother. And the third, find a dream and achieve them. Doing this thing can increase him desire to survive and have a clear future. In the first session, we set a clear boundary to avoid the relationship becoming inappropriate and set out the session duration. During the session, I let the Fitri talk about the problem and the element that will increase his depression. Remember, do not tell him what is wrong. Instead, let him tell us what is wrong. Becoming an active listener will let him be more comfortable and concerned that I might be standing on his side. When he starts some sensitive and private conversation, I use the most important technique in CCT, that was don't be judgmental. Fitri is already struggling with feeling of guilt and depression, so I show the attitude involved in non-judgmental listening, which is acceptance, genuineness, and empathy. For the outcome of treatment, Fitri became more confident and increased self-esteem at the end of the session. He accepted himself as a homosexual and being proud became a part of the minority group in Malaysia. Although his IV still don't have a cure, the medicine and this technology also can help him a lot in fighting the virus. He also thanks me a lot for rebuilding the relationship between him and his mother. He lists a lot of dreams, but he's still confused about the path he wants. But for sure is he wants to build a future with his current partner. So the last part, number and frequency of treatment session. I recommended CCT to Fitri because the psychotherapy was not a long-term treatment like other psychotherapy. Normally, CCT will start with 6 sessions and the number of sessions will change depending on the problem of client. We meet weekly for every session and Fitri only use 6 sessions to finish our psychotherapy. Okay, that's all from us. Thank you.